Let's talk about ankle instability. This is often a sports injury, but just as often can be simple turning of the ankle. The most common injury to the ankle is damage to the ligaments at the front and outside. That's called the ATFL. Sometimes when we turn our ankle, the ligament ruptures. Usually it heals back together. So the first treatment for ankle sprains is simply to allow it time. Rest it, ice it, elevate it, treat it like a sports injury. If it becomes a more chronic, long-standing problem, particularly if you're giving way for no reason, or if it feels like there's something moving around inside the ankle, that's when surgery can be useful. The first thing I would do when I saw you would be to examine you to see whether the ankle is stable and to see if there's anything problematic with the tendons around the ankle. A weight-bearing x-ray of the ankle is always useful, particularly in the first instance, to make sure there's no fractures. When it comes to imaging that I would usually get, it would be an MRI scan to look at the soft tissues as well as the bones. The most common injury that I deal with is the ATFL ligament having pulled off or ruptured and not healed back properly. In that case, we can do an ankle arthroscopy, which means a camera into the joint, clean any problems up in the joint. Sometimes cartilage can be damaged, sometimes bone can be damaged in the joint. And then after that, at the same operation, reconstruct that ligament using some bone anchors, which are essentially stitches that are put into the bone. And I tend to use something called an internal brace, which is a very thick stitch tape that's drilled into the bone on either side where the ligament goes to give the ankle more stability, particularly in the first months when it's healing. If you feel you need to see a surgeon about this, I'd be very happy to examine you, get the relevant imaging and operate on you should that be required. The first thing to do, however, would be to see a physiotherapist and make sure that everything is stable around the ankle and the muscles are as strong as they can be.